Welcome to your speaking role play. I will be taking the role of a patient or a relative, and you will be taking on your professional role. The purpose of this speaking role play is to get evidence of your ability to communicate with a patient. Try and use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
So I will give you your scenario now, and you have 3 minutes to prepare your scenario. We'll start your role play once the 3 minutes are over. You can make notes, and I'll give you a pen to do that. But you must return the role play card to me after we've finished. So that's your information. You can start preparing now.
Yes.
All right, that's the end of your 3 minutes. Please start now.
Oh, hi, Bhavna. Nice to see you again. I got a letter from the hospital a few days ago. So unfortunately, you had an admission this week. Can you just tell me a bit about what happened?
You know, doctor, some days I'm doing very, very well. Everything's completely fine. But, you know, sometimes things get very bad. People say things happen, and then you can't go on with life anymore. I think that's what happened the last week. I just couldn't deal with anything anymore, and that's why I had like a bottle of paracetamol at home, and I took all of it, and then they had to take me to the hospital, and they gave me some injection, and then they told me I'm fine, I could go home. And I don't know why I'm seeing you now, because they said I was fine.
I'm really sorry to hear about what's happened. From what I see from the letter is that you were feeling really low, and then you took some paracetamol. Did you intend to end your life when you took the paracetamol?
Yeah, I just couldn't take things anymore, and that's why I had to do it. I'm not even sure if I'll do it again, but yeah, that time I did want to end my life, yes.
Can you tell me how your mood has been since you were discharged from the hospital?
I mean, doctor, I won't lie to you now because I've known you for so many years. When I was in the hospital, they asked me a number of questions. I think they were trying to screen me whether I was going to do it again. And I've heard from my friends that if that happens, then they put you into a mental ward. And I didn't want that to happen to me. So I lied a lot. They asked me about my appetite. They asked me about things. How were things at home, and I lied. I said everything was fine. This was just a one-off thing, but things aren't fine. Yeah.
Okay, so I know your mood has been quite low for a while, but do you feel it's getting worse now?
I mean, yeah, it is getting worse. Yeah.
And your partner was at home with you before. What's happened recently?
So this happened on a Saturday, and on the Friday we had a breakup. He said he couldn't deal with me anymore, and that's why he left. So now there's no one at home.
Okay. And are you still going out and seeing your friends and doing things you enjoy?
So after I got discharged from the hospital, I did go and spend some time with my family, but they're busy. So I came back home, and now I don't want to bother anyone else with everything. And I'm sorry, I think I'm bothering you as well.
Of course not, that's what we're here for. I'm glad you've come in to see me today. Are you still getting any thoughts of ending your life?
Some days are good. Some days you can't take it anymore, and that's when I get these thoughts again. But I'm not mad, doctor. I'm not crazy.
Nobody thinks you're mad, and I don't think at the moment we need to admit you into the hospital or send you to a mental institution, which seems to be what you're worried about. Although I do think that you need some help. I know you're not taking any medication or anything at the moment, but how would you feel if I started something today?
I've heard that the medications make you gain weight, and they make you very sleepy. I don't want that to happen.
Okay.
I don't think that's going to impact my life in a positive way if that happens.
There is several different types of medication, and there is one that I know which can help you, and it won't make you feel drowsy or make you gain weight. So would you be happy to start that treatment?
I mean, I can try. Yeah, I have no other option now.
Okay. There's also an option to see a therapist, which I also think might be helpful for you. Would you feel happy about seeing somebody to speak to them about what's been happening?
What do you mean by a therapist? Do you mean a psychiatrist?
Not a psychiatrist, but a psychologist. So they are able to do some talking therapy with you. These sessions will help you cope better with the situation that you're in, and also they will teach you some coping strategies which you can maybe do at home when you are feeling very low or suicidal again.
What's the difference between a psychiatrist and this person?
So the psychiatrist is another doctor who is specialised in mental health, and they would see you if you were feeling very unwell and the treatment that we have given you hasn't helped, then we would send you to them. But I don't think we need to address that yet. I think at the moment we may be able to help you just from the GP surgery. Okay. Just a few other questions I wanted to ask you today, Bhavna. Is that okay?
Yeah.
I know you're getting these symptoms of sort of suicide on and off, but do you ever get any thoughts of self-harming?
I mean, I'm not a very brave person, and I'm quite timid. I won't really cut myself or jump in front of a train because that scares me. But yeah, I sometimes think about taking sleeping tablets and just trying to sleep the day away, just to make the pain go away.
Have you ever taken anything?
No, not yet.
Okay. Do you have any plans, or have you bought any medicines and kept them in the house?
No, I just get these thoughts, but then I try to stop myself.
Okay.
Except for that one time, I'm usually able to stop myself.
And do you smoke?
No.
No. Any alcohol?
No.
No. And do you take any other recreational drugs at all?
I did experiment when I was younger, but not now. No.
Nothing regular. No. Okay. And how are you sleeping at the moment?
I mean, I'm trying, but sometimes I wake up at night and then the thoughts come back again. Doctor, if this happens again and it's 4 a.m. at night, I don't want to bother you because you obviously have your own family. What can I do then?
Okay, so we do have a crisis team in place. I will give you the details for them. What you can do is that you can contact them any time of the day or night. So they are available 24 hours a day, 7 days a week. It's a phone number. You can call them, and they are specialist mental health people on the other end. So they can help you and talk you through your situation. If you need special care after that, then they will arrange that for you. Okay. So just to summarize everything today, I know your mood has been quite low recently, but it seems to have unfortunately taken a turn recently due to your partner leaving you. So what I think would be best for you at the moment is maybe to start some treatment to help you with your mood. Okay, this medicine shouldn't make you feel drowsy or put on weight. However, please don't suddenly stop it. Make sure you take it every day. If you do feel like you want to come off of it, come and see me and we will take you off it slowly. I'm also going to refer you to a therapist so that you can maybe have some talking therapy and talk through your problems and see if there's anything they can do to help with your symptoms. Okay. I've also given you the crisis team number. This is for you to keep on you for 24 hours a day, 7 days a week. If you feel like you did the other day before taking the overdose, then call this number and see if they can help you. Okay. I also want to see you back in 2 weeks, okay, just to see how you're getting on with the new medicine. So I'll arrange that appointment today. If between now and then you start feeling low again or you're having any problems with this medication, come back and see me sooner. And if I'm not available, see one of the other GPs. Okay. Do you have any questions at the moment?
No, I think I'm all right. I'll just try and do better the next time.
Thank you so much for coming to see me today. I know normally the first step is the hardest, so I'm glad that we've been able to have this chat today. Okay, and I'll see you back in 2 weeks. Thank you, Bhavna.
All right, that was the end of your role play. Thank you. Imagine if you were someone who had had all the troubles in their life. They tried to do better, but still they couldn't. And then they tried to take their life. Now this person is faced with a doctor or a nurse who sounds judgmental. They sound a little rude. They sound like they're trying to preach and trying to give you advice without really meaning it. How would you feel? This was again a very, very difficult scenario. A patient with suicidal ideation or a patient who's had a suicidal attempt is something that we should approach with a great amount of sensitivity. The OET does test you on this very, very difficult scenario. It is a scenario that you can possibly fail in if you mess things up. I keep on repeating again and again that this is an English exam. This is not a clinical exam. But when you're nervous, when you're struggling with your English and you don't know what you have to say, you will mess this station up very, very easily. So that's why what we've done is that we've given you a little script, or we've given you a pair of crutches as to how you can go through this scenario, and by using these crutches you can appear sensitive, you can score well on your clinical communication criteria, and when you're confident in what you're going to speak, the mistakes that you make in your grammar and on your linguistic criteria will be diminished. I'll be a little clinical in this scenario, the way I describe it, but again, this is a test on your English, just keep that in mind. When you approach a patient like this, or if a patient like this comes to you in A&E, the first thing that you evaluate is their risk. Risk to self and risk to others. So if a patient has committed or tried to commit suicide before, and then they come to you again, you need to assess, are they at risk of doing it again, and is that in the near future? That's what the GP did at first. So she did go through asking the patient whether they felt suicidal at this point. So that's very, very important. That's how you start this scenario. When you're asking someone why they committed suicide, please, please, please do not sound judgmental. You saw the GP's body language. She leaned forwards. She had a facial expression which demonstrated sympathy, and when the patient was relating her story, she was nodding along and giving her visual clues. What that does is it shows empathy and sympathy in a more natural way rather than saying I'm sorry again and again. A few different ways you can try and demonstrate your grammar and sympathy. You can tell the patient that I understand life has been very hard for you. If I was in your situation, I too would have a lot of stress. Or I can only imagine what it would have been to be in your shoes. So those things, if you use these sentences, your grammar will look better and you'll score well on your clinical communication criteria. The second thing that the GP went through was through this patient's lifestyle. Alcohol, smoking, drugs, sexuality, they are taboo points in many of the countries that we come from as immigrant doctors, and we sometimes mess these up because there is a cultural gap. If you tell a patient who drinks a lot or a little, and you tell them that you're an alcoholic, and this is a patient who's just tried to commit suicide, 1, you'll fail this scenario. Second, it'll prove that you are a very poor doctor or a very bad nurse. So just be sensitive on the words that you use. Let's just try and think about ways that we can counsel a patient on alcohol use. So using sentences like that is above what the recommended allowance is for alcohol per week. Have you ever tried to cut down? So that just sounds a little better than you need to cut down, you drink a lot. So just try to bear in mind, if you were that patient and you had this stranger talking to you in this way, a stranger who comes from a different cultural background, Another thing that we as immigrant doctors also might struggle with are points like sexual promiscuity and partner preference. You are a doctor, you are a nurse, it might be a taboo in your country, but in the OET exam or for a patient in general, you are not supposed to judge them. You're supposed to get a good history and you're supposed to provide them treatment, nothing more. Please do not sound judgmental on your OET test or in your real life when you come and work with us in the NHS. Then another point that the GP did cover was discussing a rescue plan. So the patient talked about what would she do if things get bad in the middle of night. So the GP did provide her with details of a crisis helpline. So make sure you make a rescue plan in this scenario. A thing that the GP did extremely well was that in the end she just summarized what the discussion was, and she just tried to go through with what plans were made during this discussion, especially in a patient who's so stressed and who's had multiple problems dealing with her issues in the past. Providing a clear plan and a clear summary just helps calm the chaos in a patient's mind. Try to do that in your OET exam and try to do that in your real life. But otherwise, as I stated before as well, this is an English exam. If you go through the works and you produce good grammar and full sentences, you should be able to pass this scenario, provided you do not make the big blunders that I've explained. Good luck.